Okay, are we good to go? Welcome back, guys. Okay, sorry for the delay again. I know you must have had nice food and you might be obviously a little drowsy now, but this is one of the important thing which I want to tell you because I don't want my students to get pricked by these needles. Okay, absolutely no. So we shall discuss in detail what are these needles and why are they important for your exams. First and foremost, here what we have. Okay, you can see that there is spinal needle. Spinal is what? It is a sterile spinal needle with a needle with stellate in it. Okay. Usual the gauge what we usually use in pediatric age group is around 22 gauge, which is black in color. I'm going to show it to you. Okay. Okay. First we are going to see it here only. Fine. This is black in color. Okay. This is a spinal needle which I want you to identify first. If any examiner tells you that this is the one which been given to you other, you should identify that this is a spinal needle, okay, or lumbar puncture needle. Anything is good. Are we good to? Hmm? Now, like fairly, if you see whatever the parts I have labeled on the screen, that there is okay, it is there in the name only that there must be some needle, there must be some catheter, and there must be lure lock. Okay. Now I'll explain you what is lure lock now. Okay. Once lure lock means it is one of like it. This lock is utilized again multiple places. Okay. Like in other instruments also they use this lure locks. Okay. Means you don't want the inside needle to move it like this. Okay. Now you can see one, if this is the stellate, you can see like this, see like this. Once if I fix here, it will not move like this. Okay. Now I want you to show that this is a spinal needle. Outside cover, see this is inside. Okay. This entire this thing is called spinal needle. This is entire spinal needle. This is stellate we have removed like this. The moment we remove stellate only, the LP, this thing CSF starts to trickle down. Okay. Parts you got to know this entire needle. Okay. This is outer one, catheter you can tell. Then this is the stellate. And you have a special lock here, which you can see here, guys. Okay. Fine. So this is a spinal needle. Okay. And the lure lock. Okay. You can see here that there are multiple colors. Each and every color they denote their gauges. Okay. And I told you earlier that Birmingham's gauge, or earlier when we were discussing French, the French, as and how the French was what, it was around one third of the this thing millimeter. Okay. And here, as and how the gauge starts increasing, if I tell that gauge is 24, okay, then the diameter decreases, then the diameter, internal diameter decreases here. Gauge means we are talking about internal diameter, French means we are talking about external diameter. Okay. Yeah, now this, you can see these needles of different color, they have different gauges. Now, why do we want to use this? We use this spinal needle to do something called as lumbar puncture. Okay. Whenever we suspect that in cases like CNS infection, like meningitis, encephalitis, this is the time where we want to do a diagnostic lumbar puncture, and by that we can get to know that what either it has occurred because of bacteria or viral, or it is because of something else. Okay. That is the reason why we do this LP. Then next, there, okay, subarachnoid hemorrhage also you can get to know, and even the other indications could be pseudotumoral cerebri, where little these are rare little. Okay, you usually won't end up doing that. Inflammatory CNS disease like Guillain-Barré syndrome. Now I will tell you here only that the specific or the peculiar finding here is what you can find is albumina. You might be knowing cytological dissociation. Means there is discrepancy between the amount of cells and the amount of protein. Okay. Albumin, here I am talking about protein. Albuminocytological dissociation, which is usually seen Guillain-Barré syndrome. Next, you can also use this same what do you say, the same procedure or this lumbar puncture for installation of intrathecal dye, and for imaging procedures like myelography. Again, this is little rare, And yeah, occasionally we usually do check CSF pressure. The opening CSF pressures will give you fairly the idea that why this meningitis, why is it meningitis infective origin or what we can get to know. Okay, next there are other uses of this thing. Uh, I want you to even when you are like imagine now if LP needle is being given to you, I want you to answer that. Sir, there are diagnostic indications, there are therapeutic indications. If the moment you do that, you are casting an impression on the examiner that this fellow knows stuff. Even if you don't tell that Guillain-Barré, no problems. But diagnostic and this thing therapeutic, you categorize like that. Diagnostic mein meningitis, encephalitis, these things we want to do, sir. Guillain-Barré, there is albuminous cytological dissociation. Next, therapeutic. Therapeutic, yes, definitely we can. You guys have heard this thing called as spinal anesthesia. What do? They use this needle only and they give administered drugs. That's how it is. Intrathecal installation of intrathecal medications. Okay. Here in this thing I'll underline chemotherapeutic CNS agents or in prophylaxis of leukemia. What is that drug? Do you know any? It is methotrexate. Methotrexate in what disease? Appa? Methotrexate in ALL. One of the CNS prophylaxis. Okay, fine. And other things I have mentioned there: tetanus immunoglobulin in tetanus, and rarely antibiotics in severe meningitis. And another thing I'll tell you: rare things are rarely correct. Okay. I want you to answer spinal anesthesia, intrathecal medication, and these. Okay, fine. Go ahead with the next one. Okay, this is just to keep the stellate in center. Okay, just to now see. Now this whatever I had bent like this, I'll try to put there like this. Okay, like this it is. It will get fixed properly like this inside. Okay, 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 fine. See, okay. Now you want to know about this thing. This is the needle. This is the stellate which I remove. If I remove this, you can see that small projection like thing here. You can see. If I pull this, you see like this. It has become now outside. Can you see this? Outside a pile here. Can you see this? Wait, I shall use this. Here, this small projection. You saw that will go and get itself locked properly into this one small groove over here. Okay. It is nothing. It is just to keep the stellate in situ. Okay. And okay. After knowing this, now see, I want to tell you, even earlier videos also, I have told you that the moment now if we discuss something, it is not mandatory that again the examiner will ask you only about indications, only about contraindications, only about of this. Later the questions might come little different for you. What antibiotics you want to use in meningitis, like that. Okay, they will see how you answer based on that. That's how the questions are going to go. The topic is going to change moment you tell this. Like how we went from here to methotrexate, from there to ALL, like that. Okay. Now see, okay, there is this question that they have mentioned that kyphosis and scoliosis, what kind of spinal needle you want to use. Again, I want to tell that wherever you want to put this needle, you have to know the basic fact of anatomy that spinal cord ends at L2 and L3, L4 is one of the safest place where we want to do this LP, okay, so that the nerves will not get damaged. And when it comes to kyphosis and scoliosis, there rather than the needle, we have to concentrate more on where the spinal cord ends, I feel. Okay, So that is why what precaution or what we can take is much more lower than that, based on how much degree of kyphosis is there or scoliosis is there. Based on that, the needle must be pricked at the site. Here we have to concentrate on the site rather than the needle, I feel. Okay. Any other questions? Sorry. Are we good to go? Next. Now, what are the places where you don't want to do this at all? Contraindications. Here, I want to classify a little as one which are absolute and another which is relative. Whatever the first point you are seeing here, okay, absolute, absolute contraindication of LP, lumbar puncture procedure. Elevated intracranial pressure owing to suspected mass lesions. If you are suspecting any mass lesion, or like not only the mass lesion, or example, if you are having meningitis with raised ICT, there it is the time where you want to be careful of doing this LP, because that raised ICT, the moment you prick this thing in the lower at L3, L4, the moment you prick this, what happens? There is so much huge, like so much drastic drop in that pressure, that as well the brain can herniate, the cerebellar tonsils can herniate into that foramen magnum, and the baby can die. Okay, so we don't want that to happen. So the first and foremost thing what you are going to take care of this is not to have raised ICT. How will you do that? You do that by fundus examination. Fundus examination में क्या दिखता है? क्या दिखता है? फंडस क्यों करते हो? हाँ, papilloedema. Okay, fine. If there is any raised ICT, there might be evidence like papilloedema. Okay, and CT heat is also fine. Okay, and they are mandatory again. Next, fine. And other contraindication, it is going to be this. Okay, absolute contraindication again is going to be severe respiratory distress and shock, as this may worsen with position in flexion. We don't want the child's life to be in danger. Okay, first know that. And thrombocytopenia, this the reason why I have put this is here I have written this 20,000 cells per cubic mm. No, that was asked a CET question. Look, okay, or NEET question. Okay, when that time I was writing CET, so that is another way where we don't want to. Okay, but they tell that this is even classified under relative, because they tell if it is so much mandatory, they'll give a platelet transfusion and they'll do. But for time being, you remember that thrombocytopenia less than 20,000 is definite contraindication, and it has been asked question. And another thing which I have written here, local infection at that site. Local infection, I mean the skin infection. Okay, again you're not going to, because once if that is there, that can only introduce the infection inside, much more deeper inside the CNS. Then next. Okay, anything else? Okay. Now you have asked here that question that can we do LP at L4 alpha? Definitely, and you can do it, but the thing is like what we are actually wanting for that, we want it to be as less as traumatic as we want, but and we want the CSF also to trickle down at the proper way only. Okay, what we have found that the more down you do, the more lower you do, very unlikely that you might get good amount of CSF for sample to be done. And another thing, what is the next question which you have asked? That is cysticercosis a contraindication? Definitely, if it is causing raised ICT, if it is causing raised ICT, it can be one of the contraindication. Okay. Any other questions? Okay, fine. Shall we move ahead? Okay. Next, okay, I want to tell very clearly, as I told you just some moments ago, that moment they give spinal needle, they'll not ask about needle once you label it and all. Okay, they might go somewhere else. This is one table which I have directly taken from Nelson's. I want you guys to know this very well. We shall just underline or know some stuff. Normal thing, okay, I'm underlining. Is it visible, guys? Normal pressure is around opening pressure. These are 50 to 80 mm of this thing, 50 to 80 centimeters of water. Okay. Then next WBCs. WBCs, they are hardly less than 5. Even if it is 5, that's fine. And most of them are going to be lymphocytes. Then next, proteins. Proteins around 20 to 45 mg per dl we expect it to be around normal. Okay, then glucose more than 50 or 75% of serum glucose. So with this point we got to know another thing. Sir, should we do random blood sugar or glucose sampling just before we do LP? Definitely yes, because here glucose, based on glucose only we are able to diagnose some stuff. Okay, so the procedure and all you have to get to know properly. Before we do procedure, we'll do glucose random blood sampling. Okay, then the first thing what we see here is acute bacterial meningitis, where usually the pressures are elevated too much. Then next, you can see the leukocytes here are around 100 to 10,000. It can be more also, and usual this thing is range is around 300 to around 1000 or 2000. And the important here is polymorpho neutrophils, or neutrophils are the one which are important here, and they are the one which is excited. Next, proteins again around 100 to 500 mg per dl. Okay, is it visible guys? Like, or the is it the table very cramped up? Fine. Next, glucose is usually decreased because these bacteria they consume so much amount of glucose, and the CSF glucose will decrease usually less than 40 or 50% of the serum glucose what we have tested. Next, organism. Okay, what are the other comments which you want to see? Organisms are usually seen on gram stains, and they are invariably recovered by culture. So now another thing I'll tell you. Now what you have done now, the one question what they asked last year, one of the examiner, you have done LP. What are the investigations you want to done? All these headings are the investigations. One, pressure, WBC, proteins, glucose, and based on this, and here they have written culture also, culture and sensitivity. Based on this, you are going to diagnose that what happened, or I'm sorry, what happened to the baby, why this meningitis occurred or encephalitis occurred. Okay, because of what cause. Next, partially treated bacterial meningitis. You okay? Again, the pressures are around normal elevated. The WBCs can be around 5 to 10,000 or 5 to 1000. There is again good range of proteins which are increased. The glucose can be normal or even decreased. Okay. Next, organism may be seen or may not be seen because it is partially treated. So that is the thing. Sometimes it might be seen. Or the moment you give some treatment, sometimes even the cultures also might not come positive. Next, viral meningitis or meningoencephalitis. Again, you see that pressure is slightly elevated. Okay, the pressure is okay. Then next, here one very classical thing there is, like I have written, like it has been mentioned here, that rarely it is more than 1000 cells. Okay, and okay, you need not worry about those things, they are little rare, but I'll just read it out. Eastern equine encephalitis and lymphocytic chorea meningitis may have cell counts of several thousands. So forget, I want you to know that it can't be as raised as in acute bacterial meningitis. Then proteins around 500 to 200 mg per dl. Next, glucose. Generally, it is normal. You saw that both the bacterial were they decreased. Here it is normal. Okay, and may be decreased in less than 40, less than 40 in viral diseases. Okay, particularly mumps. So these can be potential neat questions which can come ahead. We don't know. It has not been asked previously that what viral disease can cause hypoglycoruria, means drop in glucose of this thing, CSF. Then it could be mumps. They have written here 15 to 20% of cases only. Okay, know that. Then comments, HSV encephalitis could be one of the cause for viral encephalitis. Then focal seizures and cause. Okay, fine. We'll go to next. For that you have to know the procedure. The thing is, like, we are discussing instruments here. We are not discussing the entire procedure of it. I want you to go through the procedure very properly, because the moment you do the LP, the moment, now imagine, now this is the what to say, back. The moment I try to enter, I'll feel a giveaway like this. The moment I feel giveaway, then I'll remove the stellate. Then this thing will start coming. The CSF will start dripping. What usually, like, to get to know the pressures, there is another special manometer which is being connected at this end, and that will decide the opening pressures, and that is how we can get to know. Based on that also, if the pressures are very elevated, usually we see that it spurts out, like the comes like a sprinkle, the CSF, when the pressures are very okay. See, again and again. Okay, now this is a legible question, that how much CSF can be reported. What is the patient you are asking me for? Imagine now this is the patient you are asking me for meningitis or encephalitis, as we do usually. Okay, 1 ml will do very good for you. 1 ml is more than enough for all the kind of investigations. Okay, how far you can remove, that is again a different entity provided on what case you have. Okay. Contraindicated in burns of entire body. Okay, I want to ask one question. Whether the question is whether it is contraindicated in burns, I want to know why you want to do LP in burns. That's the only thing. If you are suspecting meningitis in burns, is that what you are asking for? Any other questions? Let's go ahead. These are a little uncommon. The reason why I put this, not that uncommon also. Like the reason why I put this because they are potential need questions again. Uncommon forms of meningitis, the tuberculous meningitis, again the pressure is usually elevated. Now here the WBC is around 10 to 500 and polymorpho neutrophils, they are early, but usually what happens, the lymphocytes, they are the one which predominate. Almost all the time it will be around 100% and the cells will again be more. Okay, proteins again are significantly high. Okay, and the more higher the protein, they have mentioned here that there is possibility of blocks. Okay, that basal systems it might get blocked, that can cause obstructive hydrocephalus because of that what do you say, all the cell debris and all the damages. Okay, glucose is less than 50 in most cases, decreases with time if treatment is not provided. Okay, next comments, acid fast organism almost are never seen. Actually it is true. How many ever times I have done LP, not even single acid fast has come positive. And yeah, but we can send for CB-NAT. Again it is not that sensitive, so fine. Then next, another thing which we can discuss here is fungal meningitis, little rare. Pressures are again elevated, 5 to 500 cells could be seen, proteins around 25 to 500, less than 50. See, you can again ask me that, sir, everything almost is seemingly same. Definitely yes, but again I'll tell you, treat the patient, not the investigations. The moment you get this, you are going to again go back to the patient, see what clinically he is fitting into. He is having other things of viral, the history is the one which is going to yield you that it was long standing, that there was some underlying foci and then he got meningitis, or was it something else. Okay, are we good to any questions? Fine. Next, coming here, I have written here Sala bone marrow aspiration needle. Okay, this is bone marrow aspiration needle which I want you to show, and most of you will get confused with it. Okay, I want to show. I'll show you the needle. First, we'll see the needle. Full identify that needle first. In that only, I'll try to label the parts then and there only. Okay, and directly we'll go to indications. You can write down these indications, and I want you to remember at least 3 of them. At least 3 of them. I'm good to go. Fine. Now you see, okay, identification first. This is it visible, guys? This is Sala's bone marrow aspiration needle. Okay, here only now I'll tell you this outer. Okay, see here, this is the stellate inside. This is the stellate inside. This entire thing is needle. Okay, it's like trocar and cannula outside, trocar, and this is cannula, and inside it is like this stellate, like this. Now you see here, there is this another extra thing which they have given here. This is called as guard. This guard will not be present in bone marrow biopsy needle. Note it down. Okay, that how will you identify this? The presence of guard is going to tell you that it is bone marrow aspiration needle. Okay, any difficulty in this? Okay, anybody couldn't see that, anything like that? Fine. Next, then what are the indications? One, why you want to do bone marrow aspiration, sir? Why you want to prick the baby's bone marrow, and what you want to? If I am suspecting this, if I am suspecting leukemia in that baby, then I can do. If I am if I am about to detect the marrow infiltration, like in disorders like lymphomas and other non-hematological malignancies, if these are things which I am suspecting in the child, then that's when I am going to do this bone marrow aspiration. It's like cytological things. Then to rule out malignant process in ITP before starting of steroid therapy. Once when steroid therapy is started, then whatever the bone marrow aspiration reports are there, they are going to be futile. Okay. Then next, bone marrow culture in diseases like typhoid and malaria, a little rare nowadays. Just as CET they might. Okay. You can see here. I'll okay. This is what stellate. This is guard. Oh, this is Salas. This is Kimis. KLI Klima's needle. Okay, both are bone marrow biopsy needle, aspiration needle only. Need not worry. Both have the guard. You can see that that is the one common here. Okay. Oh, okay. Now we have come here. Now next instrument, what we are seeing here is bone marrow biopsy needle. Okay. The instrument is named as Jamshed's biopsy needle. Okay. I'll show you how it looks, and you can differentiate between the aspiration needle and this thing. Then where you want to do this bone marrow biopsy, there the site is posterior iliac spine. Okay. And why you want to do again, if I am suspecting that there is or if I am having a dry tap in bone marrow aspiration, I want to have that cut and cut like through and through like good chunk of that bone and that entire marrow, and then I want to see that. Okay. This is what it's like dry tap when it is not yielded much on bone marrow aspiration. Suspected aplastic anemia, if I'm suspecting that in baby or in the child, myelofibrosis, again the indications are going to be almost same, leukemia, lymphoma. Okay, okay, now you can see here this entire this thing is needle. You can see here very nicely stellate inside. Okay, you just have to, okay, what is the site here, appa? Posterior superior iliac spine. Okay, know that. And this is Jamshed's. See, no guard, nothing. No guard, nothing is there. Entire this is little wider like this. Huh? The moment you see, you must be able to identify. Okay, what are the other sides? If you want to see, it is tibial tuberosity. But again, when you want to do the aspiration of tibial tuberosity, there you have to go away from the epiphysis. Okay, means if the moment you touch to the epiphysis, again there can be problems in growing of that bone. Okay. Sternal puncture, yeah, fine, but since the almost major arteries are located there, like just beneath it, better option and safer option I feel would be PSIS. Anything else? Yeah, this I have shown, like this I have told. This is Jamshed's. What needle is this? Biopsy. Biopsy is being got through it, and another local skin infection. Again, it is contraindicated. Okay. Next, now both we saw bone marrow aspiration, bone marrow biopsy. What are the two different things here? Now I have detail here. The aspiration is the one which is giving you better cytological detail. Okay, whereas this topographical details like cellularity, infiltration, and all is seen in more with biopsy. Okay, more range of cytochemical stains and flow cytometry is possible in bone marrow aspirate, and this range is little narrowed down, and bone marrow aspiration is ideal for cytogenetics and molecular genetics, whereas biopsy it can be used again both. I want you to know this cytological things are more easy in bone marrow aspiration. Okay. True is not there. This is the biopsy. This is the aspiration needle only. Bone marrow aspiration needle. Jamshed's needle we right now don't have. Okay. Okay. So it's like aspiration and biopsy. Like one example, if I want to give you, it's like say for example now this leukemia is there. You want to know that once when you did aspiration, you got to know that there is some blast cells and all, and but you want to know, you want to confirm it. This biopsy is the one which is going to tell you 20% blast cells in biopsy. Okay, This is the one, that is the reason why you want to do this. Okay, next needle here, again it will be asked many times. I want you to first identify this needle. Okay, identify this needle. How? This is what it is, a stainless steel needle used for liver biopsy. What is the name here? Wim's Silverman needle or liver biopsy needle. Now I'll show you this, what it is. A little long and slender. You can see this, long and slender. Okay, again the parts over here are that trocar and a bifid or a prolonged needle. I'll show that. I'll even let you know why it is bifid. Okay, any doubt in biopsy? Okay, biopsy needle is not there, guys. Can't help it. Okay, fine. Now you can see this Wim Silverman liver biopsy needle is there. Again, I'll show you that earlier needles. Wait, just a minute. I'll compare. Earlier needle will stout. See, one solid thing it is. Can you see this, guys? One solid thing. But whereas this, if I remove this, this is Wim Silverman needle. Now what you can see here, that it is bifid or it is pronged. So the moment they give this needle in front of the moment examiner give this needle, just don't tell, don't see this and tell Wims. No, what you have to do, because they'll observe you, they'll see how you have done. Once when you have this thing removed that still, then that's when they'll see that okay, he has saw that bifid. That's when he has answered. This is called as bifid or pronged needle. Okay, or this pronged stellate. Now the reason why this pronged, or now you can see that these are again sharp here like this. The edges here are sharp. The moment, now I'll purposefully keep it like this. The moment we enter like this, what happens? We will rotate like this. The moment we rotate like this, these sharp edges, they'll cut open a small nice chunk of that liver tissue, and then that's how we'll get it back and we'll try to examine this. Okay. Now, okay, once when we are done with the parts, okay, you can see here the bifid or pronged. Next, what could be the reason why you want to do this? What is it? This liver biopsy. Why I want to do this liver biopsy? Because imagine now the child is very chronically having hepatitis. Okay, you want to know the cause of it. There is cirrhosis in children, Indian childhood cirrhosis, or some storage disorders you want to identify. This could be the yielding one. Or any malignancies, secondaries which has seeped into liver, undiagnosed conditions of liver abnormalities. These are the indications where we usually end up doing liver biopsies. Then next, what are the prerequisites? Before even you do this liver biopsy, it's just not that you come, you just poke the liver and you go off. Not like that. It's not as easy. There are some things which I want to check before that. Whether the child's prothrombin time is normal or no. Okay, that is one thing which I want to check. This thing, see whether he is about to bleed very badly or no. And all get a blood grouping and cross matching done priorly. Just in case if it bleeds, you have to counteract that. Then vitamin K administration is another prerequisite for the clotting, because already you are expecting some liver damage there. Liver synthetic functions are to produce prothrombin and the coagulation factors. So vitamin K administration is again helpful there. Kind of. Yeah, prothrombin time, if it is prolonged, very unlikely that we'll think of doing this. Okay, next slide here, important, IV or intravenous cannula. This one thing, especially the students, LP, see, again I'll tell you, it varies with institutions. In pediatric, if you see in my institution, wherever I had done liver biopsies, many, like even on neonates also, suspecting glycogen storage disorders. And the study of that smear of the chunk which we give, or the tissue which we give, that is being done by pathologist. Okay, but it is very well that if the institution is teaching you that, then definitely pediatricians only can do that. Okay. for all of these procedures. Okay. See, usually what happens, spinal, yeah, some amount of local anesthesia can be given. Hmm? And even this also, local anesthesia is what you are just in trying to be in subcutaneous plane. So definitely, local anesthesia you can give. Procedure part I want you to read, like it just can't be that I can tell that entire ones. I just want you to know that ये needle है, identify करो, what's क्या है बताओ, then next first know what are the indications. They might again go further, they might not as well ask that, they might definitely might ask how the procedure is done, how will you do, what are the aseptic precautions you have taken, okay, why you have put betadine, why you have put spirit, why did you use spirit later. These questions they might ask further, okay. But procedure part is not like here, it is getting to know about instruments, parts, why they are used, and what could be the problems ashte, okay. Any other questions do we have, sir? Fine. IV cannula, okay, shall we go ahead? IV cannula, these are PVC kya hai bhai? Polyvinyl chloride, okay. These are PV, or like, you please don't tell it as plastic in exam. It is polyvinyl chloride made cannulas for intravenous access, okay, where we want to gain access to any of the superficial veins. We use this IV cannula. You can see here this entire IV cannula I have put here on the pic. Is it visible? Okay. This has one thing here, needle, and the catheter. This catheter, it actually runs. Wait, I shall open small. Opened here. Okay. Okay, wait, just even we go more deeper in this, what you have to do is, anyway, as an undergraduate, my advice, you take it. The moment you see some new instrument like this in your hand, always, even before you remove any cover of it, I want you to very well see what is been written on that, or even before you tear this, see here they have written vaso fix, lure lock, lots amount of information you can get here. One, I'll try to prove it here only. 22 gauge, is it visible guys? 22 gauge means that is the size of internal diameter which they are telling you. Can you see this guys? 22 gauge. This is one information which you got just because of the paper which has been put here. Another information I'll tell you why it is important. Please cultivate this habit again and again. Just before, just beneath that 22 gauge, they have written 36 ml per minute. That's the amount of flow which it can give through this small, through this diameter cannula. Next, another thing they have written here, sterile, EO, means how it has been. Imagine now, the moment you start having this habit, you get to know that, okay, this has been sterilized by ethylene oxide, this has been sterilized by this has been sterilized by that. So this is how you are going to increase your knowledge, and not always that you have to go to the book, you have to be observant. Okay, coming back to this needle this thing labeling, we saw that, okay, we had to open, right? Okay. Okay. Is it fine? I'll repeat. Okay, no problems. See, I'll let you know that first, the moment if you are taking this in hand for first time, what you'll do? Oh, as a normal layman, you see what is this? Oh, this is some blue color, some white is there, and after this, oh, there is some sharp structure here like this. This is what it is, needle. This is stainless steel needle. I'll open that like this. You can see this stellate kind of thing. This is the needle, main thing. And if I remove this needle, you can see this catheter here. This is the one which is staying off in the vein. Not this needle will not stay. Okay, remember that. Okay, very unlikely that you as undergraduate might be putting cannulas, but still it is a good habit for you to put cannulas, go to your casualties, do that. Oh, we'll label that fast. Oh, enough. Then catheter. Bushing, you do not bother. I want you to know that injection port cap. This is a port by which now not always that you have to administer like this. This 3. This is 4. Not always that you want to administer drug with on the side which I have labeled as 4. You can even give some drugs with port injection port cap. If you just remove that cap, from there you can also give IV drugs. Then next, this needle grip, you can see this here. The moment you prick this, the moment you prick the entire like see this, the moment you prick entirely like this, here we hold like this and we try to separate like this. This is the grip which it is needing. Okay, fine. Flashback chamber is the chamber which, again, anybody who is putting cannula for first time, that is the one thing which I want you to know. Flashback chamber is the one chamber where the end of this entire stellate, the entire of this what is it, this needle, it is coming and ending here in this some small transparent chamber here. That is called as flashback chamber, because the moment you prick blood here, here blood starts appearing first. So that is the time where you can get to know that I am in vein, I am not in vein. You will get to know easily. Okay. So yeah. So yeah, as a layman, you got to know that it was blue color. Here in diagram, it is pink color. What are they? We'll see. You can see here multiple different types of cannulas. There, here, there. This is orange. Okay, gray. Then this is green. This is around. This is pink. This is blue. Yellow is the smallest one. Even smaller to this you can get. This is purple. Okay, smaller to that. Now, what question they have asked here is that what and all gauges they are. Okay, what gauge of cannula is this? For that, you try to remember this one small mnemonic. Next slide is there. Okay, the small mnemonic you can see here. Okay, small this thing you can see that orange, gray, green, pink, blue, and yellow. How do you have to remember this? Okay, I'll write it down. O, girl in green. Like if anybody is wearing green top or shirt, oh girl in green, please bring your parents. And okay, if you just remember this, oh girl in green, please bring your parents. Okay, this is enough. How, like, if, but you have to know that you have to, the orange is going to start, either remember orange wala or either remember purple wala, that it is 26, and start reducing 2 2 or start increasing 2 2 as in how you start knowing it. Is it legible? That is the, guys, is the mnemonic legible there? Oh girl in green, please bring your parents. Legible? You can see? Okay, fine. So based on this, the reason why I have put this here, it was asked in NEET question just some 2 years ago. Okay, that what color would be, what kind of gauge is pink color cannula? You would have used, but I again want to tell, see here. Based on this, it makes much more easier to score. Next, okay, fine. It is, see, that's what, now see, okay, wait, I'll use this, okay. See now, what is happening? Fine, are we good to go? Now see, the question what you have asked is that, sir, abhi do end hai, okay, why we have to, why we need this? It is nothing but what sometimes actually we might need more than one port, and another thing which we might need more than one port to administer some drugs, okay. And moreover than that, the moment you try to fix it, if you are fixing this cannula, you are going to fix it like this. Put the plaster here on top like this and then fix. Every time you try to use this, you are going to disturb little, okay. And imagine now, imagine there is this case of meningitis where you have to give 21 days antibiotics. Now you imagine this cannula is there in like with the plaster like this. Every time you try to remove, now see, this will be capped here. Just a minute, I'll show you. Every time you remove this cap, like it will be behind here like this. Every time you, now it will be fixed like this. Every time you remove this cap, you are going to disturb this little, okay, and that might as well end up in as well losing this cannula, or it might even give its way away off. So what if so much of this thing is there, let this thing be like this here only. You, after nice plaster, what you do is you can start giving antibiotics, start giving drugs from here, okay, fine. Any other questions, guys? Please, okay, should all the kind of like any kind of questions which you have, because next we are going to discuss the instruments which were asked in your NEET exams prior, like might be 1 year ago or 2 year ago. So they are again hot topics just based on these instruments. Their questions are being asked repeatedly. So that's why we'll go out with that. There is this question that why there is valve in it, and so can we use it to draw blood? As far as I remember, I have not labeled or I have not told any kind of valve here, okay, so I want you to be more elaborate. Valve ये नहीं है यहाँ पर. Valve will allow the unidirectional flow. कहीं भी valve है, यहीं पर नहीं. अगर आप मशीन में भी यूज़ कर रहे हो, valve है तो unidirectional flow आप expect कर रहे हो, okay, but this is now two direction. The moment you enter into vein, if you remove this, it will easily flow. It can be used for blood draw also, like drawing blood also. For investigations, you can use this. Any other questions, boys? So we'll go ahead. Chalo. Okay, oh, girl in green, please bring your parents. Fine. Need based image questions. We'll see what is first. Okay, anybody who can tell this? You? No. This is called as orchidometer. Okay, the moment they show this, this was asked again. You can see in your NEET questions, NEET question banks. This is called as orchidometer. The different sizes of this you can liken or resemble to the this thing, the testes of a male child, and you can get to know that how he has matured. Okay. So based on this, this orchidometer, now the moment you see that orchidometer and this much is the test in that Tanner staging, they're not just the growth of the testis, the testicular volume they'll consider, okay, and that is where this will come into play. Like for example, now here it is 10, so it will mean like okay 10 ml, okay, this is the volume which we want to tell it in this stage. So read Tanner staging. That is the question which they might ask if you get this. Okay, let's go ahead. About this. Okay, the repeating the question where you have asked that there is valve. Now see, imagine now, okay, this is valve. The moment you try to prick, the moment you remove this entire the needle, now see it is like this. There is this needle. The moment you remove this entirely this valve, like it is like as good as non-functional. Only thing is like it is again making it as unidirectional. The blood from here we want to go it to here. Not that air might enter this side. Okay. The moment you remove this, it will start getting filled with the blood only. Not that air will come inside it. Okay. Fine. Okay, and wings are there for pasting the plasters. Where were we? Orchidometer. Okay. Tanner staging. That is the one thing which I want you to read. Anybody? What is this? You? Anybody? Next question. Okay. These are first identify as Harpendens. Okay. Calipers. Calipers, wherever they are there, they are usually like not only here, even in physics or even in engineering, if you are using calipers, these kind of calipers means they are, you are trying to measure the thickness. Like calipers, bole to kya bhai? This is like once when the distance between this is identified, this is calipers. Now here you can see that they are using the skin there. Okay, what are the areas where the skin or where we want to know the skin fold thickness, by which we can like comment on the nutrition of the child? Where first and foremost, like you can use it on biceps, then triceps, back. Okay, this is where we are using this skin fold thickness. Okay, we'll. Okay. Okay. Suprascapular or infrascapular region also. Okay. I want you to identify this. Questions might come based on nutrition here. That this is the thickness, this is the thing, what you want to do ahead. That might be your options. Next, okay, anybody who can tell this? Okay. Audible? Okay, now see here we have seen that Siddharth has answered correctly that it is Shakir's type. Definitely yes. Okay, you know what could be the next neat question for this, you Siddharth? What is the level where they are categorizing as red? Less than what? How much centimeter? Less than mid-arm circumference? Less than this is classified as red, or it is undernourished, or which one is under green and it is like properly nourished? What it could be? Less than how many centimeters? You can see here it is very clearly available, like you can see it. Less than dash centimeters, it is going to be mid-arm circumference. Less than, it's starting from where pa 11.5, the red is starting, then that's all. 11.5 centimeters is starting, then from here it is going to be undernourished. And whatever you see here yellow, from 11.5 to 12.5, okay, probability is there. And whatever is in green, these are the people who are normal, like normally nourished. So you are expecting the like mid-arm circumference of more than 12.5 only, or at least 13 to it to be green. Okay, any questions, boys? Again, here more of nutrition questions might be asked. As I told in CET, they might ask red color denotes how much of centimeters of mid-arm circumference. Those things which you have to concentrate. Okay, that's what I have told right now. That's earlier it was little different. That they used to ask this Shakir type. The moment you say what is this, it is easier to for you to answer that it is Shakir type. But now the questions they have upgraded, like they have upgraded the levels of it. But they have started applying this, like where this mid-arm circumference or what next it is going to come, and how this Shakir type is being applied in this case. Can we use this in this case? Like that case scenario they might give and they might ask. Okay, Shakir type. Fine. Anything? Next. Okay. Fine, guys. Come on. What is this now? Why do you see that it is so bluish color screen? Eyes closed. What is this? Yeah. Phototherapy unit. Anybody answered correctly? Oh, there are people. Nice. Hema has already answered, and Shubham and Apurva. Okay, it's increasing. Definitely. Phototherapy is the correct answer. But do you think that they'll ask anything about like you do you think that they'll ask questions like okay, now bilirubin is this much, so what kind of this thing, Repeatedly asked question is wavelength. What was the wavelength of the this thing phototherapy or this light, blue light? Okay, it is around 420 to 470 nanometers. Okay, this is the CET question. Another little higher level question what they have asked was what was the irradiance? Irradiance is different. Okay, irradiance it is 30 microwatt per centimeter square. Okay, based on they'll use a separate uh, like what is say separate estimating machine. They'll see at very multiple different points and they'll calculate this irradiance. Okay, what other questions what I am expecting here is and another thing which I want to tell you here that by now wait, let me make it like this. What mechanism by which it will decrease, or what is the mechanism by which the phototherapy unit decreases the bilirubin? Or better put like this way, the most common mechanism in the phototherapy unit to reduce the hyperbilirubinemia. There are three, at least any of these three you can tell, but I am asking for the most common. This is how the applied things have come up. Any polymerization, do you want to improvise, madam? Okay, Nagbhushan here has come with very correct answer of structural isomerization. Definitely yes. Okay, and even Suhas, you have mentioned as structural isomerization and even including Meghna and others. Meghna, okay, can these people tell that what is that structural isomerization means? What is getting changed to what, or by what form it is getting converted to from this thing to the other thing? Yeah, okay. Up, 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 up. I'm fine. Okay, here this one of the students they have mentioned it very nicely. Most of you have answered it very good. Okay, I don't know. There is this guy called as God. He is also answered Namrata, Swagatika, Gauri. Almost all you have answered, but I liked this answer. This Swagatika. She is mentioned very correctly that it is getting converted to lumirubin and excreted in form of urine. Excellent. Any other guys? Wait, just a minute. Is it visible in the phototherapy unit? Complications, and I am expecting. Okay, I am not telling that this will definitely come. I am expecting that there are some blood flow velocity changes, especially in cerebral and renal arteries, renal vessels, that they might ask further, because expect like seeing all this kind of higher applied questions and how that is going to fetch you. I right now can't tell renal or cerebral. Okay, velocities of this. And another thing which I want to ask, okay, why have you covered entirely this eyes and this thing, the pampers, this thing, the genital area? Why? Oh, eyes. Guys, see, I am waiting for you guys to answer and I have muted it. That doesn't mean that audio is gone. Okay, I am actually seeing this and I am wondering, okay, at least you guys are thinking or have some thought process. So I'm just going through whatever the comments are coming here. I want to know that what way are you thinking? Are we both in the same path or like are we left off very behind or ahead? Okay, we shall cut it off here. Audible, guys? Okay, fine. It is for the eyes are protected to prevent photoretinitis. Is it visible? Okay. And then this what the genital cover is usually like some tests have been like or some studies have been done where they have noticed them to have this thing where squamous cell carcinoma they have found of the testis because they have been exposed one or the other like in sometimes in their life, but it is again like it has been mentioned in PubMed. Very rare again. Again, I want to tell that rare things are rarely correct. Fine, but it is better always to be like precautious, like take precautions rather than be sorry next day. We'll go ahead, Nan. Any other questions? Fine. What is this, guys? Please answer. You might have seen this. Is it audible? Yeah. Fine. Please do not answer this as spaceship. It is something which you would have seen very often in your neonatal intensive care. Wait, am I audible? Fine. Now see, you guys have started answering that radiant warmer. Incubator क्या है? I'll ask here only. What is difference between this incubator and radiant warmer? Any brief, like just in one sentence, can you make out? Can you tell, madam? Can you? अरे यार. Hmm. Convection. Almost all they have answered. Their incubator radiant warmer. Okay, definitely yes. This is radiant warmer. Most of you have answered it correctly. Now, okay, any answers where they have mentioned that how it is different from incubator? Any answers? Mechanism of heat generation in radiation in okay, that is smart. I just want to see that. Mechanism of generation is radiation in warmer. Okay, fine. Okay, am I audible? Yeah, open system. Okay, this some madam. This madam Saida. Okay, she is asked. Okay, open system. What do you think then incubator is then? Incubator is closed system. Fine. That also you like for time being you keep it with you. We'll discuss that once again once when you see. Radiant is definite here the production. Okay, it is via the heat. Production is via radiation. Actually, this tungsten filament earlier they used to use. Now this is earlier they used to use this. Nowadays, quartz crystals. Quartz is being utilized to produce heat, and you can see this. I'll draw there in that this thing. You can see this small square here. Okay, this that much area they'll have this tungsten filament like this, and above that there will be some curvature like this. These are called as parabolic reflectors. Because of this now this is the tungsten filament, this is the parabolic reflectors. Because it is this shaped, almost all the heat the this thing the way it is going to give heat is under this only like this. Okay, fine. Radiation warmer, the questions what they might ask is pertaining to the temperature of newborn. How, what is thermoneutral environment? What is the normal amount of temperatures which you want the baby to be kept, or how this can be used in hypothermia? These are the questions which they can ask. Any questions which you have got? Bulb like mechanism used in Yeah, fine. Right now, to okay. See, I want to know now. The moment you identify radiant worm, that's not the end. From here, the question starts. From here, the questions might be more on your hypothermia, on the thermoneutral environment, how temperature is playing an action. That might be the one thing. Next, any? Okay, now please, what is this, guys? Hmm. Okay, any answers? Somebody mentioned convection. Ah, it is incubator. No, convection incubator is convection type of heat loss. Correct. Correct. There, there. Okay, fine. Now this is incubator, as most of you have labeled it or identified it correctly. Incubator, definitely yes. You can see here apertures. Through this you will be handling the baby. Either you want to do some procedure put around this. The reason why it is being kept closed is it will even maintain the humidity. Not only that, it will even maintain the humidity, and it will try to keep the environment as similar as to it is there in the mother's womb. Then you know that this will be exclusively used for preterm babies, low birth weight preterm babies. Okay, and from here the question and somehow answers that that is convection type of heat is lost. That is one question which they have asked. Okay. Okay, here one question is there. It is more of logical question, and this is okay. I'll read it out the question. God, okay, that fellow is asking what to use if radiant warmer is absent. Arey, yaar, definitely in the place where I have worked, because it was government hospital, there are 120 babies. We don't have a radiant warmer for everyone. If that is not available, I advise you to use a good bulb. That's enough. A good big around 100 watt or like around 120 watt good bulb is suffice. And you try to swaddle the baby. Okay, once when swaddling with that bulb, you can still give good amount of heat. Okay. Ah. Now the question is that whether radiant warmer is better or incubator is better. Okay. As far as I have seen, this incubator they are like real like or they are used exclusively being used for preterms. What they had seen on long run, like recent studies, they got to know that this humidity was the one which was causing sepsis in the children. So that is why they ended up started using radiant warmer only. Okay, fine. Fine, guys. This was amazing. For and thank you for all the responses. You got glued with us. Even it is like around 4 o'clock. Yeah, 4:30. That was amazing attendance. That's good. I want to thank Akhil for all the technical issues and which made this live class possible, and even you guys, and even including the students who are not of our college. Thank you. Fine. Am I audible? I still there? Okay, fine. I want you to know, I want to know what is the next topic which you guys want from me to to be taught to you. Yeah, in white. Audible? Okay, please type in comment box what you actually want to know, what you want to me to take the class. Do mention in your comment box so that we'll concentrate on that. We shall take a leave. Okay, any other questions? Last check. Shall we do last check? Hey, CVS is already on White Coat Talks. You can as well subscribe yourself. CVS. So many people who are telling CVS. Cyanotic congenital heart disease. Cyanotic heart disease. Yes, definitely, man. We are going to come there. Okay, most of you are even asking CNS. Fine. After this CVS, once it's better we don't go hodgepodge. We'll finish CVS properly. Then we shall see for CNS. Is it fine? We'll take a final leave. Okay. So, okay. Thank you.